Hello everyone. So this is just a small guide on the FRCR exams. FRCR means it's the Fellowship of Royal College of Radiologists. For clinical oncology, it has three postgraduate medical exam. That is FRCR CO1. CO is clinical oncology part one. Then the final part is divided into 2A and 2B. So these are the three postgraduate exams that you have to clear for you to get GMC registration. Just a brief overview on the number of papers and how it is held. So part 1 CO1 has four papers, single best answer questions like MCQs. It is held twice a year on two consecutive days. I'll be telling that details in a while. Coming to eligibility, you need to have a primary medical qualification like MBBS. There is no clinical oncology training required for you to appear for this exam. For FRCR Part 2A, you have two papers, clinical oncology, a single best answer, and you have to pass both of these papers in a single setting, whereas it is not required for you to pass all the four papers in a single setting. For CO1, you can take one paper each time, or two paper at a time, or even all the four paper at a single setting. You need not pass all of them in a single setting, but for FRCR CO2A, you need to pass both of this in a single setting. For you to be eligible for CO2A, you need to pass the first part, and you need to have 3 years of clinical oncology training. For CO2B, which is the final part, it has clinical exam and oral exam. You need to have passed 2A, and then again you need 3 years of clinical oncology training for you to appear for this exam. Coming to the questions and the syllabus, so for CO1, on day one you have cancer biology and radiobiology exam, and clinical pharmacology exam on day one. Physics and medical statistics on day two. So cancer biology and radiobiology have 50 questions which you have to appear in 2.5 hours, and pharmacology 40 questions in 2 hours, physics 50 questions in 2.5, and medical statistics in 40 questions in 2 hours. Coming to 2A, it has two papers which are having which consist of 120 questions, both of which are having 120 questions in 3 hours. Paper 1 consists of respiratory system, urology, head and neck cancer, skin cancer, CNS, gynecology. These are the question weightage. And in paper 2, we have breast, lower GI, upper GI, hemat, miscellaneous, which consists of thyroid, sarcoma, unknown primaries, palliative care, and regulations. There are also image based questions, and these are the weightage of the questions for part 2A. For part 2B, it has a clinical exam and an oral exam. Clinical exam, which contains 5 stations. Again, I have not much information regarding this. I'll be telling that later. Okay, coming to the resources of CO1, the general resources that you can follow for CO Part 1 is TMC, Tata Medical Center, Kolkata conducts a preparatory course, which is very good for FRCR Part 1. And then there are RCR Learning Hub question banks which you can follow. And on the RCR website, you can search for FRCR suggested reading list, among which I found useful, or for cancer biology, the molecular biology of cancer by Lauren Pecorino, and for radiobiology, basic clinical radiobiology by Kogel, and for clinical pharmacology, BC Cancer Drug Manual, for medical statistics at a glance, for physics, Siptian physics of clinical oncology. For the MCQs that you can follow for physics is RAFEX, even though this is not the FRCR questions as such, but RAFEX therapy questions are considered close to FRCR exam questions, and therefore most of them follow this. For radiobiology, you can follow the astroradiobiology questions. For clinical pharmacology, BCCA drug monographs, which are important, and cancer pharmacology and cancer pharmacotherapy review book, nice guidelines for palliative care and supportive care. And for medical statistics at a glance. The other resources that you can follow are sample FRCR questions which are present in the RCR website, The web, clinicaloncologyregistrar.com is another website by Shafali Parekh, which is also a very good. Instant Oncology on Instagram is also very good. There are also flashcards available on brainscape.com. You can check those as well. The references I checked before making this video is RCR website, IMG Connect, and there's a Quora page by Dr. Bhargav who has explained all the resources in it. I'll drop down the link if required. So that's it for this video. Thank you.